Hi, fellow therapists. Today we are going to be going into what a DAP note is, what is included in a DAP note, why it's important, and also some hacks to completing your DAP notes quickly and efficiently. And I'm excited to get into what you have to do for a DAP note. So for people who've never done a DAP note or maybe need a refresher, this is essentially an abbreviated version of a SOAP note, if you're familiar with that. But it is essentially a progress note format that you can follow, so that way your notes are timely, they're efficient, and it can help with things like continuity of care. So there are three parts of a DAP note. The first is the D, which stands for data. The A is for assessment, and the P is for plan. So let me break that down really quick. So D is data. So this is anything that is observable. These are facts related to the session. So for example, if you have a client named Lucy who struggles with anxiety, in this part you were saying client showed up late, was apologizing profusely for showing up late, seemed really fidgety throughout the session, and self-reported feeling heightened anxiety symptoms and a higher pulse rate. The second part is assessment. So what we're doing here is we are writing out basically what we're able to gather from all the data in the session, how we're assessing using our clinical judgment about what's going on and what might be helpful for our client to provide a really clear snapshot in this moment. So here you're putting those observable things that you're seeing that, she's showing up late, she seems super nervous, she seems super fidgety. This indicates, based on our clinical knowledge, that she might be experiencing some anxiety right now. In this section, you might add things like client reported in session that she recently lost her job. That would add to the data that we're collecting to support that anxiety diagnosis and what specifically we're needing to treat here. We're also exploring any other triggers that exist or things that are making things better, worse, in the middle. That's all really important for the assessment part. So in this next section, it is plan. So we are planning what to do with all of this information and how to best support our client. So this client, Lucy, with the anxiety, in this section, what I would do is I would talk about maybe a coping skill that I taught to the client in session and had them practice. And maybe part of my plan is having that client try that coping skill outside of session 3 times a week. I would add that to the plan. I would also maybe help that client identify triggers and things that come up when that coping skill can be useful. I would put that in the plan area as well. In the plan area, I also would put details about how frequently we're going to meet. When is the next time I'm going to meet my client? Or if I feel the need to reach out to that client psychiatrist, maybe part of the plan is next time we meet, I get a release of information so that I can collaborate with the psychiatrist. So again, just a quick format, really brief, but let me show you what that looks like on an AI-based platform. So on this AI-based platform, what it's doing is it is recording the session and it is filling out this DAP note format and is going to save you a ton of time. So let me show you how to do that real quick. So in this example, I met with a client named Lucy. This client was struggling with anxiety symptoms after finding out she lost her job and came in with presenting anxiety symptoms. And in this session, I helped her manage those using some CBT skills and a guided meditation. And I also gave her some homework. So what I did is I recorded that session and I uploaded it to Mentalyc. And when it uploaded, this is what the DAP note looked like. So we have all that important data right here. So the date, where it took place, how long it took, all that good stuff. So first is the data, like we talked about, the chief complaint. So she was complaining about anxiety and it presented in session. We added a quote, so that was pulled from something the client directly said, where she said, "I feel more anxious than last time because I lost my job and I was running late to this appointment and I was worried you would be upset. The client's anxiety has led to sleep disturbances and job loss due to chronic lateness. Her lack of transportation also limits her job search to walking distance positions."
Some psychological factors that we are looking at here are her saying, I haven't been sleeping because I've been so anxious. We also can take a look at that clinical interview. There wasn't any indication of risk to harm to herself or others. We also can add to the data from this session that the therapist used CBT techniques, and those are known for managing anxiety and improving sleep. And we provide the little rationale for why it was used. Next is assessment. So this is where we pull in our clinical skills and just explain how the client is responding to treatment, any progress that we're noticing. So the client reported herself a decrease in anxiety symptoms when practicing the coping skill in session of the guided meditation. Some specific examples or instances that we can look back on are that the client shared she felt less shaky after listening to a guided meditation in session, and challenges to progress that we might note. So the client losing her job may increase anxiety symptoms, and some stress related to financial means for therapy. For the plan, we include homework. So she is to journal anxious thoughts before bed and try a guided meditation. And the plan for future sessions is to continue focusing on coping skills. And we are planning to meet the same time next week, and we'll add additional sessions if necessary for this client. For coordination of care, there's NA, because in this session it wasn't necessary to reach out to her psychiatrist or anything like that, so that's totally appropriate in this case. What's also nice about Mentalyc is that if you want to provide more detail or change how something is worded, it's very easy to go in and do that. And then all you do is you say save to records, store it, and it signed the note for you and you're good to go. So that's it. That's a DAP note using Mentalyc. Hopefully it was helpful to have me break down what it includes and then to kind of see it pieced out into data and assessment and plan. Thank you so much for watching and have a great rest of your day.